The topic is osteoporosis that is bothering senior citizen. Let's simplify that today. With the blessings of Dr. Shada Jain, she has helped me a lot in this. So we start with what is the definition. So what is osteopenia? When bones are weaker than normal, but not so far gone that they break easily. This is called osteopenia, which is hallmark of osteoporosis. And osteoporosis means porous bones. It is characterized by low bone mass, architectural deterioration of bones tissue resulting in fragility, easily break, and increased susceptibility to fracture. So we can see three types of bones. One is normal, and I think osteopenia, less dense, and osteoporosis very much porous, so that it easily get fractured. We can see there. So what is the incidence and what is the impact? The osteoporosis affects 1 in 3 women and 1 in 5 men over 50 globally. But in India, 50 million people are at risk, largely underdiagnosed and undiagnosed as well. India is aging rapidly. 30 years from now, the elderly population in India is expected to triple from 104 million to 300 million in 2050. So osteoporosis is silent until it breaks. Most people don't know that they have it until a fracture occurs, mostly hip, spine, or wrist. Hip fractures carry high risk, 20% mortality within a year. Over 50% suffer long-term disability due to hip fracture. Vertebral fractures can go unnoticed but can cause pain, loss of height, and kyphosis. People start bending with the age. They think this is my aging, but no, this is vertebral fractures unnoticed maybe. So think twice, because economic burden is huge. Treatment and rehabilitation both cost high. So prevention is far more cost effective. What is bone remodeling? How to prevent? So we should know what happens in our bones. There is 2 sequential stages: formation of bone and resorption of bone. Bone का resorption हो गए, shallow हो गए, पोलो हो गए. Then bone cells involved are osteoblasts and osteoclasts. जो बनाती है osteoblast and जो उसको finish कर देती है bone को osteoclasts. So we can see bone mass matrix. Osteoporotic matrix is like this. How to get bone remodeling? Throughout our life, the skeleton continuously renew itself. Our body is magic. It renews every time. So the process of renewal often describes as bone turnover, enables bones to repair microscopic damages and maintain the strength. So the imbalance between it leads to bone loss. Active growth during teens and early 20s, there is a good bone mass. It peaks around 30, but then slow loss observed in early 40s, rapid loss following menopause, and continuous loss throughout 70s and 80s. जो हमारा बोन बैंक है, बोन्स में जो कैल्शियम बैंक है, वो हमारे पास 25 से 30 साल की उम्र तक हमने उसको भर लिया, आगे तो खाली ही होना है. So peak comes around 30, 20 से 30, 40, then it declines rapidly. So how do we get osteoporosis? See, aging say we are losing our piggy bank, our bones, they are getting fractured because we are losing our calcium. So who is responsible? Estrogen. Estrogen is needed for proper closure of epiphyseal growth plates in females. It promotes the activity of osteoblasts, which are key cells for making bone. It increases bone absorption directly or indirectly by stimulating 1A hydroxylase activities in the kidneys. Other factors are vitamin D deficiency, widespread in Indian elders due to limited sun exposure. We were just talking that we should walk in sun and lekin ma'am, sun exposure between 11 to 3, 11 a.m. to 3 p.m. So UVB rays, only then we can get some vitamin D, and that too through exposed skin. We cannot walk bare. Calcium poor diets. Most Indian lack calcium diet because milk. Females mostly offer their milk to males and grandsons, sons, but they forget to take themselves. Sedentary lifestyles of these days, not पीछे अपनी दादी नानी का नहीं, लेकिन nowadays there is a sedentary lifestyle, lack of weight bearing exercises accelerates bone loss. Poor awareness, we don't know, अबे यहाँ पे गिर जाओगे. So many seniors believe bone pain is just old age and they ignore warning signs. Other causes are long-term steroid use, smoking, alcohol, thyroid disorders in our country. Not smoking, alcohol, not so much prevalent here. What are impacting factors? Net bone resorption and net bone formation. कितना खर्च हुआ, कितना बना. So resorption, inactivity, so low serum calcium, hypothyroidism, corticosteroids. But how to get our bone formation? Weight-bearing exercises, good estrogen, androgen, growth hormone. If we maintain our thyroid with thyroid hormones. How to diagnose now if we are osteoporotic or not? So the important factors of diagnosis is history. History is the very important factor. Then how to examine patient, what are the signs and symptoms of the patient, and then later investigations. So history, kya age hai, parity, because how many children she has delivered, how long she has lactated, whether she has taken calcium during lactation period or not. Is there any history of fracture in parents? What is her age of menopause? History of fracture during her fertility or premenopausal phase, or any history of comorbidity, hypothyroidism, diabetes, hypertension, any old investigation if she carries any drug intake. We can ask for impaired vision, early estrogen deficiency before premature menopause, dementia, poor health, history of falls, and low physical activity. So what are the risk factors affecting peak bone mass? Nutritional factors we know now, calcium, vitamin D low, anorexia when they're not eating properly, environmental factors, smoking, alcohol, caffeine, medication. But these days, alcohol intake, smoking, caffeine, medications are increased. Low physical activity, hormonal factors, and genetic, and some medical conditions as well. So what to next is investigations. We have taken history, we have examined the patient, whether the patient is walking straight or some gait is different, she's little kyphotic. Now we know when patient is fine, now we have to go for investigations. First, blood test. Bone markers, single photon absorptiometry, single energy. This I've made it little colored because Bharat mein we are not doing this and easily availability nahi hai. So we'll not discuss about this. X-ray and CT scan, of course, little bit. And the best test for detecting osteoporosis is bone densitometry. Dual energy X-ray absorptiometry. अपन commonly कहते हैं DEXA, and then MRI. What to do in blood test? Simple. CBC, blood sugar, thyroid, calcium, phosphorus, alkaline phosphatase, creatinine, vitamin D, and parathyroid hormone. See, X-ray nowadays people are not doing, but in periphery we can detect osteoporosis when it is severe. Not early detection नहीं हो सकता, but in severe cases we can come to know by X-ray. We can see the density of the bones they are varying in both the X-rays. This is normal X-ray, and that is osteoporotic. We can see condyles that are osteoporotic. Normal osteoporotic. Next is CT scan, but CT scan when MRI is not available, then we can go, but we have more irradiation with CT scan, so we do not go commonly with this. So the most common and gold standard is DEXA. Simple test that measures bone mineral density. Often the measurements are up to spine and your hip, including a part of hip called femoral neck at the top of thigh bone. The test is quick, no pain. It's similar to an X-ray, but use less radiation than X-ray. It's done like this, and we can come to know normal bone and osteoporotic bone. So DEXA test results are scored by comparing with BMD of healthy people, the same age sex. We cannot compare कोई का 25 years के साथ में या कोई 70 years के साथ में. It should be compared in the same age sex. The result is measured in T or Z score. So what is the difference between T and Z score? They are same, but T score standard deviation between population of 25 to 29 years. And Z score is between the same age sex above 35 years of age. So scoring is same, but just the naming is different. When we say T score, it is up to the 35 years of age. More than that is, we call it Z score. So -1, say less than -1, and +-1, that is a line of gradation. POC है ये हमारा. इसके नीचे जाएंगे osteopenia and osteoporosis, then normal bone and density. So now, because we are considering in senior citizens only, so I'm talking about Z score. Bone density is higher than in others, so the same age and sex and body size, +1, 0, -1, -2, and -2.5 indicates secondary osteoporosis. There are peripheral scans also, type of DEXA, which commonly we can get in our hospitals or at periphery. They measure bone density in heel, finger, wrist, and forearm. It has limitation because this is not access early osteopenia. What is FRAX score? Fracture risk assessment tool. Because it estimates chance of fracture in major bones over the next 10 years. इसके अंदर we calculate many factors like age, sex, weight, height. There is history of previous fracture, parents fractured hip, current smoking, steroids, rheumatic arthritis, secondary osteoporosis. Many factors is considered to know what is FRAX score. But limitations that does not include factors that affect fracture risk, such as falls. Then other is OSTA score. OSTA means osteoporosis self-assessment score in Asian women. This is the chart. It is available everywhere. Online मिल जाता है अपने को ये chart. So we can come to know at what age with the weight हम कितने risk में हैं. Low risk में है, moderate में या high risk में. It is measured like age में से अपन weight घटा के multiply करें 0.2 से, then also we can come to know कि हम कितने risk में. Then other is MRI's advantages our all investigation, but is it little expensive and not available to masses. So who need bone densitometry? Post-menopause 5 years, we all need. Perimenopause with high risk of or history of fragility fracture. There is previous radiological fracture, and before starting any therapy. Lean body mass, they are more tend to get fractures. If we see in this OSTA score also, we see age with less mass, less weight, they are more at high risk. Bone trabecular mass measurement, estrogen deficient women undecided about taking hormones. I don't want to take hormones. Anyone taking long-term corticosteroids, they're all at risk. So, what is important to know? India needs a national osteoporosis registry like some countries to track and prioritize high-risk population. डॉक्टर शारदा जैन की देन है ये सब. Global best practices. Sweden osteoporosis risk card में they, in that country they have promoted calcium rich diets, स्कूल एजुकेशन है, सिटी प्लानिंग, एल्डर फ्रेंडली वॉकवेज हैं एंड फॉर प्रिवेंशन. We have to learn in our country what we can take from these countries. Australia fracture license services are there available. They ensure evaluation of every person over 50 years with a fracture and manage their osteoporosis. This way they reduce secondary fractures by 30%. Japan में there is a locomotive syndrome. They screen all adults over 40 years, promote early detection and stress on mobility exercises. So our mission is strengthen and sustain bones, prevent fractures and treat osteoporosis. Individualized evidence-based approach is needed for all. This India-specific advantages in 2025. There should be such programs. Flex score special use in rural setups without DEXA. Awareness should be via health melas and elderly. So, what is the take-home message? Estrogen deficiency is the reason for osteoporosis. Osteoporosis is a silent disease. Broken bone is the first problem. Early diagnosis is always advantageous. History and lifestyle are very important. DEXA scan is gold standard. Management according to T score or Z score. So we should love our bones and take care of that. Thank you so much.